Hi, everyone. Welcome back to the Mom and Mind podcast. I am your host, Dr. Kat, perinatal mental health certified psychologist. And I am really excited to welcome on my dear friend and colleague, Dr. Marissa Long. We are going to be talking a lot about fertility and fertility journeys and the mental health impacts of that journey, both from the patient's experience of the process and the patient's experience of dealing with and interacting with medical care providers. And there's a lot to cover, so we are going to get into it. And just know, as usual, on all of our podcast episodes, we are talking about parts of an experience and not the whole entire thing. So you will hear a lot of really good information and probably be able to resonate if you were on that fertility journey yourself, or certainly if you are a provider looking to learn more about what a patient's experience might be. So Dr. Long is going to really help us get into it and find out how patients can be affected by this process. Dr. Long is a sought-after expert in the field of reproductive psychology. As the owner and clinical director of ARC Counseling and Wellness, a private practice in Southern California, Texas, and Louisiana, Dr. Long is dedicated to helping individuals and couples who are going through fertility treatment, as well as women with high-risk pregnancies and pregnancy loss, to relieve the emotional distress associated with these challenges. Dr. Long has also just recently launched Psych.D Book Club, an innovative book club facilitated by therapists to support mental health, self-help, and social connection through conversation and education. Dr. Long is also a lifelong dancer. She even performed during the halftime show of Super Bowl 32 and in the Sydney Opera House just a year later. As you can tell, Dr. Long has a lot to share with us. So let's get into it and meet Dr. Long. Wow, that's an amazing set of skills you have, Dr. Long. I am so excited to have you here. It is a long time coming. As your friend and colleague, I know how much you contribute to the field of reproductive psychology and perinatal mental health. And I'm really excited to have you on to share your expertise with our guest today.
I'm glad to be here. Super excited.
Yeah, I want to start off a little bit with kind of giving a primer to everyone who's listening about what a health psychologist does, and specifically your area of expertise.
Yeah, absolutely. It's a funny question because I'm thinking back to a conversation that we had a couple of years ago, and you said every psychologist should be a health psychologist, and I was like, yeah, you're right.
Yep.
And yet we're not, right?
Mhm.
So a health psychologist has extensive training in where the body and our mental health very specifically connect. So when we have health issues, whether it be chronic pain or illness, cancer, we're in a hospice, we're dealing with a family member or loved one with severe physical health issues, disabilities, whatever it may be, and the connection to a relation of those things to our mental health as well, and vice versa. So sometimes when our mental health is poor, then it will, create certain things that show up in our body in ways that health psychologists are more astutely trained to kind of recognize and write referrals for and support too.
Yeah, again, like just going through the list of things that you were talking about, it's just, I'm so frustrated that all of us aren't trained in this.
Right.
Especially because we talk about the mind-body connection so frequently in psychotherapy across the board. Why is it that in sort of like, traditional mental health training, we're not talking more about how the body and mind are connected in these ways? After all, like health is mental health and mental health is health. Like this seems pretty straightforward, but here we are. So, so very specifically, what in terms of your area of expertise and specialization with fertility, what kinds of issues and challenges are you seeing with your patients?
Yeah, so there's no real typical fertility patient that I see, but folks will come in with, a long time struggle of trying to conceive, whether that long time for them is 3 months, 6 months, 6 years, 16 years. And by whatever time they've come in to see a reproductive psychologist, typically they're recognizing that mind-body connection within themselves and wanting to get ahead of it so that they can be in the best space possible as they're going along their fertility journey, or they've already had significant emotional, mental, relational impact from their fertility experience, and they're coming to kind of repair and recover from that. The fertility journey really starts from when you decide you want to conceive to long after you have conceived, if you've been, given birth or adopted or had a surrogate or whatever journey you decide to choose. It's not as simple as what people often think for themselves or for their patients or their friends, that fertility journey completely resolves once you conceive or once you have a baby. It really continues long after.
Yeah, that's quite a span of time. Um, I'm just thinking about the fact that this could be years and years.
Exactly.
Maybe too, if there, multiple fertility journeys to have multiple
Mm.
children as well.
Mm. Yeah.
What if you can go just a bit deeper into some of the reasons why someone might be reaching out to you specifically,
Yeah.
the kind of depth of experience that somebody might have in their journey.
Yeah. Yeah. It's interesting. I would say about half of the fertility clients that I see are self-referred and half are referred by their medical provider. So the folks that are self-referred are often coming because they either just can't figure out what's wrong with them.
Mhm.
Using my quote fingers there, they are crying a lot, they're extra stressed, they're missing appointments, they're not
Right,
sleeping.
right.
They're having difficulty in their relationship, either just in terms of communication or being on the same page with their partner about their fertility journey, or sexual issues that come up because of what a lot of the fertility process can do in the context of a sexual relationship. And then there's the folks that are referred by, a medical provider, their reproductive endocrinologist, or the nurse practitioner that they work with at the REI's office. And when those referrals come in, it's a bit of a different presentation. Those folks are typically coming in for one of two reasons, either because the medical team over at the REI office is has been witness to some distress, either the patient's crying in the office or refusing to stop treatment even though they've reached a natural end, or something like that, or a provider is wanting the client to go through some sort of process that would require a assessment of some sort, whether it's having a donor egg or sperm or something like that.
So if you can quickly give us a little bit of an explanation of what a reproductive endocrinologist is and what REI
Yeah.
means.
Yeah. So REI stands for reproductive endocrinology and infertility. So
Mhm,
your REI doctor, your REI team, just a quick and easy way to say it.
mhm,
Reproductive endocrinologist basically is a specialist in making babies happen for folks who are
mhm,
looking to conceive. So they, know all of the um, reproductive organs, the medications, the procedures, and they and their team will take you through the entire fertility journey from once you step into the office until they hand you off, depending on your particular presentation at between 8 to 12 weeks into your pregnancy, to your OB for completion of your pregnancy.
mhm. So somebody could be working with an RE for some time then, trying to get to the point of
Absolutely.
being pregnant and staying
Yeah.
pregnant.
Yeah, absolutely. Depending on, what the presenting factors of fertility are in the individual or the couple,
Mhm.
um, they could be seeking reproductive support from a RE doc for a few months or several years.
Mhm.
Yeah, so they really become a team in the process to conceiving.
Sure. So I think a lot of people associate or would call this kind of doctor like a fertility doctor, in
Yep.
kind of layman's terms, so to speak.
Hmm.
So if somebody were to be seeking this kind of fertility doctor support, what types of treatments might an RE be supporting a client with?
Yeah, well, generally the initial is going to be just tests and assessments of each individual involved in the process to see what the fertility issue is. Sometimes it's a female factor issue, sometimes it's a male factor, and sometimes it's a combined factor, and sometimes it's unknown. And once they, do their tests, do their assessments, then they can determine which procedures they might recommend to the conceiving party to move forward with to make baby. And so some of the most well-known kind of fall under an umbrella called IVF, in vitro fertilization. But some others might be IUI or ICSI, as we call it, where there's assisted procedures to mix sperm and egg or mix sperm and egg through injection. So it kind of depends on what the presenting factors are, what the steps are that a client or couple might go through. But those can also be repeated several times depending on, whether conception is achieved and maintained, financial resources, which is a very, very real factor across all fertility treatments, not just IVF. So there's a lot available, and science is adjusting and growing every day. So the rates of success are, shifting from time to time, and available treatments are shifting from time to time as well.
So, I think what I hear a lot from people is the impacts of these processes on them and their mental health, and certainly their physical health as well. And I think you alluded to it a little bit ago when you were talking about like the impacts on the sexual relationship for a couple. Is that there's sort of like a medicalization of the process, or it becomes very just like rote and something we have to do.
Mm,
So the emotional part sometimes is absent, or it feels like it's hard to connect to in the way that people are hoping to conceive, like,
mm,
through connection and through intercourse or
right,
whatever way it is that they had envisioned becoming pregnant, to
right.
going then having to have the process become medicalized and sort of sterile in some ways.
Mhm.
What are you seeing are some of the impacts just on from the process of trying to
Mm.
conceive on the patients?
Yeah. So I think you hit it right on the head there. And I want to back up a second and just name that a large part of the issue that nearly every fertility patient experiences is that there's this betrayal of what they thought was going to happen. So the dream, the idea, what they see go on around them, and what they've been raised understanding has to happen, that person A and person B fall in love, get together, decide to have a baby, and boom, their baby is. And instead, there's maybe that first part and that second part, but not so much that third and future part. And that is actually the start of where the emotional impact shows up. It's a body betrayal very often, and it's a betrayal of what we thought we knew to be true in just how life goes.
Right.
And yet, a consistent and constant seeing that happen for other people around you, people you know and love,
Mhm,
and
mhm.
strangers.
Sure.
So that's really the first part. From there, what we see a lot of, and this is in any research you look up, in my own research, a lot of anxiety is present for fertility patients,
Okay.
and a good amount of depression as well.
Mhm.
Um, because there's a variety of factors involved, and a lot of depending on other people, depending on medication, depending on processes, depending on procedures, there is not a ton of control that fertility patients really truly feel.
Right.
Though they may execute all of those things and engage with all of those things, that lack of control related to something that you always understood was just going to happen for you
Right.
is very, very hard to manage emotionally, while being way on top of treatments and injections, medication, and all of these things that are required from you at a very timely, in a very timely way. Um, you brought back up the relationship aspect, which is huge for those couples who decide to go through fertility treatment. there's a pretty huge impact. And often one or both parties are really struggling with the fact that sex sometimes has to be timed. Their sexual relationship is, for some people, feeling like it's on display to a whole medical team that you've kind
Mm,
of invited into your life and into, your bed. So it
right.
can be very, very difficult and off-putting for
Yeah.
folks.
Yeah, for sure. Oof. Yeah, that betrayal that you spoke about. Yeah, I've heard a lot of folks. Yeah, well, I think to what you alluded to or said is being like mad at their bodies and ashamed in some way. Like, why can't my body do
Yeah.
this?
Hmm.
And that is just
Hmm.
incredibly painful of a
Yeah.
feeling. This thing that I think in terms of myths of like, this is what women are built to do. And
Mm.
if you have a uterus, that means you can make a baby. And these kinds of comments from society and really misunderstandings of how stuff really goes down.
Right.
And then that person is there in their home by themselves, feeling the weight of, well, why can't my
Mm.
body do this? uh
Right.
that
Right.
that and I mean that feels like a direct line to if it goes on for a long time to like stress and depression and anxiety.
Absolutely. And another piece there is, as I mentioned earlier, there's sometimes male factor or female factor. When it's one of the parties as opposed to the other, then there's also feelings of guilt that show up in the relationship often.
Oh yeah.
And that shame directly in the relationship, not just in the community as a whole, but like,
Hmm.
I'm, your partner, I'm supposed to bring you the eggs, I'm supposed to bring the sperm or whatever it may be.
Hmm.
And, I'm failing you, my partner, in this. I've had people say, like, I should just leave them because they
Oh,
can probably have a baby with someone else. And that's a really devastating blow
oh my
in the
gosh. Yeah.
relationship context, right?
Oof.
Yeah.
Yeah. That's really deep. And I think you mentioned when you first started that everybody's journey is different, and no one's
Mhm.
journey, follows the same track or the same emotional experience
Right.
necessarily. But these are some really common things that
Very
that people are
common.
talking to you about for sure.
Yeah, yeah. And I think another common one that is not spoken about enough is that once a fertility patient achieves pregnancy and maintains it all the way through, there's this expectation for themselves and from other people and even from their providers that like, okay, everything's fine, you're good to go. And that
Mm,
is so far from the case. Often
right.
there's a peak in the experience of anxiety during the pregnancy because you've worked so hard and put in so much effort, time, money, tears into getting pregnant. And then there's the fear that, oh my gosh, I might lose pregnancy.
For sure.
And so even after that pretty key time when people tend to have a reduction in their anxiety after that
Hmm.
12th week, that's not always there for fertility patients because they're very, very aware, whether they've had previous losses or not,
Right.
that there's a fragility when it comes to reproductive health that they had not previously known or conceived of. And so now they're kind of white knuckling it, so to speak, through the rest of um, their pregnancy. And then after the baby is here, oftentimes there is an extra anxiety about almost the fragility and the preciousness of the baby that they work so hard to have that is not seen as much in folks who did not have to go through that
Sure.
fertility journey.
Yeah,
Um,
absolutely.
and then beyond that, even when time has passed, there can still be surges of like jealousy for people who get pregnant all of a sudden or weren't expecting to,
Mhm.
or random people just walking by who are pregnant
Yeah.
in recognition of the trauma that they experienced just trying to get pregnant.
Yeah, you and I were in a store together the other day, and there were so many pregnant women in there. And you said right away, this would be like a fertility, someone who's going through fertility issues and a nightmare for them.
Yeah.
And I think that speaks to one. I think it's awesome that you're that aware that like your clients would feel upset in this situation.
Mm.
But yeah, it speaks to just how also silent that is. It's
Yeah.
such an internal process. It's not like somebody who's going through fertility treatments is like yelling at other pregnant people, like, how did you get
Right.
pregnant? It's
Mhm.
inside and they're sitting with it and it's stewing.
Right.
And that you sort of can't escape that. It's
Mhm.
everywhere. Um,
Right. All the
and
time.
right. And so like that unexpected, you're just walking into a store to get a shirt or something. And here you are now
Mhm.
having to deal with, okay, here's all my pain and grief
Mm.
and sadness and shame.
Yeah.
Just here it is.
Yep. Yep. Right in Trader Joe's. Yep.
Right. Right. It's so tough
Yeah.
to have to weather that kind of a storm when you
Absolutely.
least expect it.
Right. Right.
So I want to, if we can, shift slightly gears to understand what you're hearing from, at least from people who are going through the process of fertility treatments, what kinds of stressors they feel either from or in relation to their medical team, medical
Mm.
providers,
Yeah.
because of this medicalization of it.
Mhm.
Yeah, what is happening on the medical side that might be impacting the patient?
Yeah. Well, a whole lot.
Okay.
So there's just the treatments, the medication
Mhm.
is a separate thing from dealing with, appointments, medical staff, and medical team. So on the medication and treatment side, uh, there's a whole lot going on. Admittedly, more so for women than for male identifying patients in the fertility process, but there's medication that makes women very, very bloated, moody, tearful, breast tenderness, all sorts of stuff at a time when, as you said before, their fertility struggle is pretty silent, and yet their body is kind of sometimes raging with a whole bunch of things going on, and they're just having to do their regular job and go to work and tend to their family or to whatever, but a whole bunch is going on for them. There's a whole lot for folks in that, that we could be here for days talking about.
Right. Yes.
But it's a pretty difficult part of the experience for some, and of course some don't have many side effects, if any, related to the medications. But every client I've ever seen, that's, so
Yeah,
that's a pretty significant factor.
can you in terms of how these medications, and there's like shots to take and all of this stuff, how what are some common things you see about how it impacts people's mental health?
Yeah, yeah. So keep in mind that by the time someone is, doing injections, taking medication, they've already invested in many ways into this process and are probably already pretty darn stressed out, if not anxious and or depressed.
Right.
So when a medication comes on board, and really any medication, but specifically these medications that impact our mood and our hormones and all of that, the dip down into depression or the peak up into anxiety, and honestly back and forth and consistently between the two, is pretty common. And it may only be for some folks for a few days or even a few weeks. But when you are already right there on the edge, on the brink of those experiences, or already deeply into it,
Yeah.
it can feel pretty wild. And I've had folks, report that they just feel kind of out of their mind. Their partner saying like they're not acting like themselves. And fortunately, it is short lived. These aren't not they're not long term ongoing complications of medication once
Mhm.
they've been discontinued. But it's a bit of a wild ride for some while they're going through it. And when you connect that to trying to conceive, with your partner, or with the physician in office, with the lab involved, it's a bit tough to stay connected to yourself and your partner into the process.
Yeah, for sure. And I'm glad you mentioned that it's short lived, because that
Mhm.
sounds like it could be potentially overwhelming or off putting, and um, when somebody's already dealing with so much at that point too. They're like, oh, I assume they're saying like, okay, well, this is where we're at and this is what we have to do, because the
Yeah.
goal at that point is so strong.
Mhm.
Like you said, by the time they've gotten to that point, they're so invested. So, all right,
Yep.
whatever. It's so interesting. It's kind of like it's in some ways it makes me think that it's not the first parts of like mothering or parenting, but it is
Mhm.
the like I will do anything to have
Yeah.
this baby kind of a feeling.
Yeah.
It sort of falls in that category, I think.
Absolutely. I tell my clients all the time, you're a mother, you're a parent, you just don't have your baby.
Hmm.
Like
For
you
sure.
were acting as the parent or acting as the mother, creating that space for your baby to enter and to be safe and cared for. You just have to do it before they get here.
That's a really important part of the process.
Hmm.
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 Wow, I think
Yeah.
we can definitely spend a lot of time on the mental emotional impacts of all of
Yeah.
this. And I want to also understand a little bit more about what happens in the process with the medical team.
Yeah.
Um,
It's
Certainly
huge.
there's the medications and all of that, which is quite a lot.
Mhm.
But what are you hearing from patients in terms of their like what makes a good experience for them versus what makes it
Yeah.
more stressful?
Yeah. So fertility treatments are very time sensitive, and fertility centers obviously know that. And so they work really hard to be available, every day and at all the times in order to get people in and work around schedules and all of that. But I said this recently on another space that, businesses are made up of people.
Mhm.
And people have bad days, people have good days, and people fail. And when you're going through such an intricate process that is so intimately meaningful to you, and you have to rely on someone who's answering the phone to have a good attitude, or to book you at the right time, or your window to be met, it can be pretty rough. It can be pretty rough. I will say, in my experience and what I've heard from my clients, for the most part, their experience with fertility teams is uh, much better than their experience with primary care teams, or whoever else, in terms of like how the team is more consistently like pleasant and accommodating. And so it's really, really good. But that does not mean that the team is deeply connected to the emotional needs of patients and the psychological distress that they're going through. And so a lot of times there can be a disregarding of the emotional side of the patient experience, because the team just wants to get you pregnant. And so they're not likely all the time tuned in to, I'm now going to ask you to do this other treatment. This is a whole other $20,000, or your partner's not here to help you discuss it, and you're not in a place right now to make decisions on your own, or whatever might be coming up for any patient or couple
Okay.
that's going through this really deeply emotional process. They do become aware when folks are presenting as anxious or depressed in a way that then impacts their ability to move forward with treatment. And that's typically when they tell them to get the call. But there's so much that's going on around that. Honestly, there's another bit in there that I really wish medical teams paid attention to more, which is, and some do, which is when there's celebrations or acknowledgments, or honestly even other patients in the waiting room who have already gotten pregnant, right? Some teams have gotten it figured out, and they'll have a separate waiting room for folks who have already achieved pregnancy and from the folks who are actively in the process, and which is just brilliant. But it's a lot. It's a lot to go through, and we know, bless them, but we know that medical folks are not typically trained in the psychological. They're not trained to really hold emotional space for the
Yeah.
patient, and it's so highly needed. And so when you're a fertility patient and you're looking for a team, you're just looking for somebody with the best results and that gets the job done and gets you in quickly, because everything's so time sensitive. What
Right.
you're not looking for necessarily is someone with the fantastic bedside manner, or who really gets the emotional mental health side of it until you need it. And by then, you're already kind of committed to the process with this particular provider or this particular team, because if they don't show up in a way that feels emotionally good, changing to another provider could be missing an entire cycle. And when in your fertility process, and when you're 35, 39, 43, a cycle could be everything for you. When you only have so many eggs left, one cycle could be all you have. Right? So the medical team is so important, but it's tough. They have a tough job, and patients sometimes really struggle with getting their emotional needs met in that space.
It's great that you have a connection to some of these clinics, and that they know to, or at least there's some point at which they realize, oh, maybe we should refer this person for mental health support. Oof. But it kind of makes me wonder how many clinics don't have that connection and access to somebody who's trained and knowledgeable and can train them even on what to look for, like how to know when to refer.
Right.
So I imagine that a lot of people aren't getting referrals.
Absolutely. Or not getting them soon enough, which is a really big deal. By the time I've gotten a referral from a medical team for a client, they should have been seeing someone at least 6 months to a year prior. And so it's the repair work in those instances is pretty tough for folks. And so, to your point, the training is so vital. And that's something that I really gladly offer to medical teams anywhere, because when to refer, what to look out for, how to verbalize certain things.
Oh, that's a big one.
Patients. Huge,
for sure.
Especially when, you've got maybe interracial client couples, you've got folks from the LGBTQIA+ community. There's a lot to really think about in how the language that medical providers are trained to use needs to be adjusted to attend to the emotional experience that their patients are having. Like, they're creating life.
Yeah. Oh, it makes me so sad to think of how many people are dealing with this without a proper referral for the right kind of support. I mean, it's already hard. It's already hard. And then to feel isolated and alone and ashamed, or all of those things that you were bringing up before, a while trying to hold up your own process of getting your baby here. I remember talking to a patient a while back about their concern that, like, it's almost like you're on a moving train, and you can't quite attend to all the things that are there sometimes, like the anxiety, the worry, how am I going to feel afterwards? Feels like the stress is building up, and then what's going to happen when this baby gets here? Like, is it all going to come up at that point? And maybe sometimes it does, but then also you're in the middle of dealing with a newborn or a baby in the NICU, or like a new set of stressors. Multiple, for sure. So having the support of a psychologist, a trained reproductive psychologist or therapist who is trained in, all of the medical side of things, like all of the stuff you were describing before, which I realize is just a drop in the bucket of what somebody would need to know to be proficient. But that is so necessary and so needed. So I love that you do this training for clinics, and I hope more clinics get this kind of adequate training.
And I would say my dream would be that there would be a psychologist or a psychological team in every REI clinic.
Oh my gosh.
I mean,
yes.
Why is that not happening? Well, we know why, right? But hopefully someday that'll be there. And I know some do, but all of them should
do that. How do we make that happen? Well, I mean, I think what I think you're alluding to is that mental health isn't really considered as much as it should be, or seen as big of a factor as it should be. Going back
until it's causing a overt problem.
For sure. Which to your point is when it's like the people are overflowing at that point and needed help a
Right.
long time ago.
Right.
Yeah. So, I mean, I think this goes back to where we started with the mind body connection and how
Mhm.
important it is that both are being considered when it,
Yeah.
especially when it comes to this like kind of sterile and medicalized experience for the patient. I'm wondering if, there is so much to know here, and I realize that this might feel overwhelming for some of the listeners, or
Mm,
maybe even very instructional and supportive, and maybe both. It can be
mm.
all of the things. When it comes to, what is something that people can like hold on to in terms of a hope and process through this?
Yeah. You know, that's an interesting question, and it's honestly a much tougher one to answer than I wish it were, because
Hmm.
it's really individual, right?
Yeah.
And so the thing that I really try to work with my clients to hold on to, each of them, is that regardless of how this ends, regardless of their kind of stopping point, whether that's with a baby in their arms or adoption or child free living or whatever it may be, they are still a completely whole and worthy, worthwhile person,
Yes.
um, with or without baby.
Hmm.
And I think that's both the starting point and the ending point that I want people to get to,
Yeah,
and
for
that I
sure.
try to thread through all of our work together.
Absolutely. Ooh, that I felt that. Like that's so important. Ooh, and I hope people who are listening can really like deeply let that sink in because that feels
Yeah.
pretty vital.
Yeah.
Pretty vital. Yeah.
I will also say that there are resources
Mhm.
available, right?
Yes.
And a couple of places I often refer folks to is resolve.org,
Mhm.
resolve.org. Great organization that provides lots of resources and support for fertility clients and groups, support groups. There's Facebook groups these days, so many of
Yeah.
those. A lot of churches will offer support groups for fertility patients because 1 in 4. So
Mhm.
everyone's out there. There's another resource for those folks who are just wanting to like get the information that's so hard to get, which is, what is this treatment? What does this do? Why do I have to do this? How much does this typically cost? Which can be very, very helpful when you're determining which resources to use, which providers to go after, and all of that.
Sure.
And it's Fertility IQ, fertilityIQ.com, I believe. You can just type in Fertility IQ. And, the therapeutic support, I think a lot of folks don't make use of it until it's past time. And so I really encourage folks to connect with a reproductive psychologist or therapist really, really early on, as soon as you think that you might need to go this route, for that support. And even if you don't go every week or every month, just knowing that you have that person that you can pop into when you need to,
Sure. Yeah.
is invaluable, so that you don't have to do it when it feels like everything's blowing up or falling apart.
Yeah. That is beautiful advice. Thank you for giving those resources. We will for sure have those in the show notes. And I want to thank you so much. I know we just scratched the surface of all of this information and of your knowledge and experience. So I'm grateful that you brought this here for us and just
Yeah.
thank you.
Yeah, thanks for having me. I'm so glad that people are going to be able to take this in and take what they need and put whatever else they can't on the shelf for now.
Awesome.
Yeah.
All right, everybody. Well, thank you for listening. Please do find us now on YouTube and at momandmind.com. And we are available wherever podcasts are played. And you're welcome to also join us on social media. And Dr. Long, where can people find you?
On our website, which is arccounselingandwellness.com, or on social media at ARC Counseling and Wellness or Dr. Marissa Long.
Great, fantastic. And we will have all those resources also available on our Instagram account at Mom and Mind. All right. Thank you so much, friend.
Thank you.